Okay, knock, knock, knock.
Come in.
Hello.
Hello.
How are you?
Good. How are you?
I'm good. So, my name is Cassie. I'm going to be your student nurse from Kilgore College today. How are you?
Good.
Good. First, can we start off by getting your name and date of birth?
Anna Jones, 2888.
Can I check your bracelet? Okay, thank you so much. So, I'm going to be doing a head to toe assessment on you today. So, I'm going to be doing some range of motion and doing your vitals and a couple other things. Is that okay?
Mhm.
Okay, so I'm going to start off by asking you just a few questions. Do you have any allergies?
No.
Okay, on a scale of 0 to 10, what is your pain?
0.
Okay, can you tell me where you're at?
Kilgore College.
Do you know why you're here?
Just for checkup.
Okay, do you know who the president is?
Trump.
And do you know what time of day it is?
The afternoon.
Okay, so can you tell me what you've ate or drank in the last 24 hours?
I had a sausage biscuit and an iced coffee for breakfast and a baked potato and tea for lunch.
Okay, can you tell me your height and weight?
5'1", 171.
Okay, can you tell me when your last bowel movement was?
Yesterday?
Okay, are you having any problems with it?
No.
Okay, what about urination? Are you having any problems with that? Does it hurt or anything? Any
No.
discolorations? When was your last time you peed?
About 10 minutes ago.
Okay, I think that is it for now.
Okay.
But I might come back to the questions in a little bit if I've forgotten any. So I'm gonna start off by doing your vitals. Is that
Okay.
okay? Do you know your baseline?
It's usually pretty normal.
Okay. Can't have you just turn your head like that. Thank you.
Mm-hmm.
Okay, it is 132/82. Okay, so I'm gonna put this pulse ox on you, do your O2. I'll go ahead and take your temperature. Temperature is 97.6. O2 is 99 on room air. Okay, so I'm gonna put my gloves on. I've got to look at your head and just tell me if there's any tenderness, okay? Does that hurt?
Mm-mm.
Okay. Pull those away, and I'm gonna get some new gloves on. So now I'm just gonna touch around on your face. Is that okay?
Uh-huh.
Okay. Okay, does it hurt any? I'm gonna touch around on your neck now. What about that?
No.
Okay. Okay. Okay, so now I'm gonna just look around a little bit on your face. Is that okay?
Yes.
First, I am going to look in your ears. Okay, so while I'm going ahead and do your ears, I'm going to go ahead and do the whisper test. So I'm going to have you just cover the other ear, and I'm going to say 3 words. I'm going to whisper 3 words, and I'm just going to have you repeat them back to me, okay?
Okay. Couch, arch, squirrel.
Okay, good job.
Backpack, yellow car.
Okay, yes. Okay, so now I'm going to have you just cover one nostril, and I'm going to have you breathe in real hard. Okay, can you do the other one? Okay, does that hurt any?
Mm-mm.
Okay, can you stick your tongue out and say, ah? Okay. Okay, are you having any pain in your mouth or anything?
Mm-mm.
Okay, so now, next I'm gonna go to your eyes. Can you pull down on it right there? Okay. Okay, so now I'm going to check your peripheral vision. Can you tell me when you see the pin?
No.
Okay. Can you both say?
No.
Okay, I'm gonna look. Okay, okay, so now I'm gonna do a couple things, and you're just gonna, I want you to follow my pin, just don't move your head, okay?
Okay.
Okay, so now I'm gonna have you look at the pen and look at the wall. Back at the pen and at the wall, and back at the pen, and follow it all the way in. Okay, now I'm gonna shine my light and I'm gonna look at your pupils, okay?
Okay.
It might be a little bright. Okay, now do that one. Okay. Okay, now I'm gonna have you look up there and look at the other way. Okay, now I am going to just touch right here, okay? Okay, is that any tenderness right there?
Mm-mm.
Okay, so I'm gonna have you do your range of motion right there. Okay, so now I'm gonna have you shrug your shoulders against me. Okay, okay, thank you so much.
Mhm.
Okay, so next I'm gonna move to your upper extremities.
Okay.
So I'm gonna have you just do a few motions, you can just follow me. And around. Does any of that hurt?
Mm-mm.
Okay, okay, so can you squeeze my fingers? Okay, so next I'm going to look at your capillary fills in your fingers. Okay, so now can I just have you pull your sleeves up just a little bit so I can feel your pulses? Okay, while I'm right here, I'm gonna go ahead and do your respiratory rate real quick, okay?
Okay.
Okay, heart rate was 88 and respiration was 16. Okay, so now I'm gonna move to your back and I'm gonna listen to your lungs. So every
Okay.
time I move my stethoscope, I just want you to take a breath, okay?
Okay.
Actually, can I have you just turn just a little bit and just face that way? I'm sorry.
That's good.
Okay, thank you. Now I'm going to come around to the front and I'm gonna listen to your lungs from the front, okay? Is
Okay.
that okay?
Uh-huh.
And then I'm gonna listen to your heart.
Okay.
Okay, so I just need you to take a breath every time I move it, okay?
Okay.
Okay, can you lift your boot? Okay, okay, so now I'm gonna listen to your heart, okay? I'm gonna listen down here one more time, okay?
Okay.
Okay, so now I'm gonna have you lay back and I'm going to listen to your abdomen and I'm gonna just feel around, okay?
Okay.
So first I'm gonna listen. am just going to feel around, okay?
Okay.
Okay, so now I'm just gonna press down just a little bit, okay?
Okay.
Is any of that tender?
No.
Okay, okay, you can sit up. Okay, so before I get started on having you move your lower extremities, I'm just gonna feel behind your knee, okay?
Okay.
Okay, now I'm going to touch right here. I'm just checking all your pulses, okay? Okay, so now I'm going to just check your leg for some edema, okay? I'm just gonna squeeze it a little bit. Okay. Okay, now I'm gonna do the other one just to make sure. Does that hurt?
Nope.
Okay. So now I'm going to move your toes apart, and then I am going to check your capillary refill.
Okay.
Does that hurt?
No.
Okay, so now I'm gonna have you just pull against my hands, okay?
Okay.
Okay, can you push? Okay, okay, so now, since you're still sitting down, I'm gonna have you do your legs.
Okay.
Just follow me, okay?
Okay.
So I'm gonna have you pull your knee up. Okay, can you do the other one? Okay, can you lift them up? Okay, can you, I don't know if you can because you're sitting down, can you move them out any? Okay, can you do the other one? Okay, okay, so I'm gonna test your coordination just real quick. Can you touch each of your fingers to your thumbs? Okay, I do believe that is it for today. Do you have any questions for me?
I don't think so.
Okay. Okay, well, I am going to go ahead and go report to the doctor. If you have any questions, are you in a comfortable position?
Yes.
Okay, thank you so much.
Uh-huh.
Okay, so all of my clients' lower pulses on the lower extremities were 2+ strong bilaterally. The radial pulses were 2+ strong bilaterally. Hair, skin, and nails looked good. Hygiene and nutrition were good. Eyes looked good, Perla noted. Pupils were 3 millimeters. No JVD. Range of motion's intact. Shoulders were strong. Chest symmetry was good. Anterior and posterior. Lungs were clear in every lobe. No labored. S1 and S2 in the heart were noted. The PMI palpable. Bowel sounds were normal active. Range of motions in upper and lower were strong in strength. The capillary refills was less than 3 seconds in all digits. And overall, there was just no abnormalities to the ears, eyes, nose, skin. Nutrition was good. Just everything overall was good. No abnormalities.